I'm Jamie Martin, editor-in-chief of Lifetime's Experience Life magazine and the co-host of the Lifetime Talks podcast. And I'm really excited to be with you today for this first of our two-part series on hormone health and to be here with the team from MIORA at Lifetime. We'll be focusing next week on male hormone health. Today is all about women, and we're going to be talking about the rise in hormone imbalances and issues among women and at all ages and stages of their life. So as someone who's in their early 40s, I can attest that this is absolutely a conversation that is coming up regularly within my communities. And it's really because women want to feel better, and I'm hearing that from my friends, my family. And so I'm really excited to have this conversation with these experts who have joined me today. With me, I have Jim Lavelle. He is the Chief Science Officer at Lifetime. I have Connie Brennan, who is a certified nurse practitioner and Director of Education for Medical Aesthetics. I have Dr. Greg Pippert, Medical Director of MIORA, and Cliff Edberg, who is Senior Director of MIORA, as well as a registered dietitian and personal trainer. Thanks for being here with me, all of you.
Great being here.
All right, Jim, we're going to dive in right with you from the start, because the reason we're here is because we're seeing just a significant rise in hormone health issues, not just in women, but in men. That's why we're doing this two-part series. Why is that happening, and how long has this been going on for?
That's a great question. I think first of all, there's more awareness in general of, should I feel this way in my 40s and 50s and what's going wrong? But there's a lot of factors involved in it. First of all, stress plays a big role in how your sex hormones are going to be produced. The higher the stress, the more the stress on your sex hormones. Obviously, environmental challenges. We're all hearing about the issues with environmental burden, various types of pollutants or chemicals that could be affecting our health. And you know what? Sleep is a massive issue. I know most people that I talk to, they have trouble with sleep, and that can play a big role in it. And then, of course, our panel can go through all the other various issues related to it, like diet. Are you exercising? How much are you exercising? There's a lot to why we're seeing these hormone shifts at earlier stages in life, and medications can have an impact as well.
Absolutely. We're going to dive into all of those. I want to throw it over to Connie and Greg right away and talk a little bit about what are some of the symptoms or indications that somebody might have a hormone imbalance. You've been working with patients for a long time. What are you seeing, not just in people who are in their 40s and 50s, but people in their 20s and 30s too, and for women in particular?
I'm going to pass it off to you, Greg, because I'm going to answer based on a patient and also skin and beauty, because that's where I fit in. So I'm going to let you lead it.
So when we think about the youngest individuals, the 20s, 30s, 40s, you can still have hormonal imbalance. And those will show up in things like irregular periods, cramping, PMS, PMDD, things that, visit you every cycle, every month, but they can be pretty profound and pretty problematic when they do occur. Then as we age, as things change, then we start to get into things like poor sleep, mood concerns, anxiety, depression, hot flashes, night sweats. And then there's the cosmetic things, as Connie was going to talk about. There's a sense of well-being, and so all of these symptoms can occur slowly, and they kind of leach into our lifestyle. And we don't always acknowledge that they're getting worse and worse, and they're impacting our lives and then our well-being. And then to Jim's point, if we're now already having trouble sleeping and now I have a hormonal shift and now I sleep even worse, that just compounds the whole issue.
Mm-hmm. Right. And I have young patients too that are even looking for beauty help, but when they come in for weight loss, when you think about weight loss and their bodies changes with hormones and they're maybe unable to get pregnant or they're miscarrying a lot and their inflammatory markers are really high, which does mess with the cortisol, which is a hormone as well. So those imbalances can shift them into not being able to lose weight, not being able to get pregnant. And then my older patients, midlife to older, 40s, 50s, 60s, we're looking at, how do hormones affect the skin? And they make a big difference on a patient's skin. My patients that don't have hormones on board I can tell a difference when I'm poking needles through their skin, a lot. So I encourage my patients that this is something you want to balance, because not only the weight loss program that I run can help, the hormones can help balance so many things, but also the skin itself, the ability to contract when you lose weight, the ability to form around your skeleton and your face when you're older and you're aging, and then the depth of wrinkles and sun damage and all that the hormones affect that as well. Mm-hmm. So it's powerful stuff.
Yep.
You mentioned, Jim, medications, and I want to make sure that we address, for especially in like the 20s and 30s, often in early 40s, the role of birth control and what that impact might have on hormonal health, because we do know that that can have an effect.
Yeah, it really could have a dramatic effect because, when a woman takes birth control, it's for a specific reason, right? But it does shut down a lot of the hormones that a woman normally would produce. And therefore, they could start to experience some changes in the way they feel because they're no longer making those particular hormones. And progesterone probably, I know we're going to go over the hormone specifically, but that's a hormone that can have a dramatic effect. And so it's important that when a woman's on medication, and oral contraceptives are a big one, antidepressants also a big one, and there's a lot of folks that are taking antidepressants. These are the type of medications that could be influencing your hormone health, and you're going, well, why don't I feel as good as I should? Where's my vitality? And it could have a big impact in terms of your overall wellness and the way you feel.
Yeah. When you mentioned like baseline vitality, I'd love to hear some examples or if there's case studies of patients, because I think about we often, when our hormones are out of balance, we start, at least I've heard this anecdotally, is like, this is just how I feel. This is how I'm going to feel going forward. And we've almost settled for that. Why, have you seen examples, or tell us a little bit about some examples of people who have come in and felt like that, but then seen improvements, or what were they coming in with and how did they adjust from there?
Probably the one that I think about the most, because it was dramatic, is a patient came, probably 48 years old, came in, and her stated reason for coming is, I need to save my marriage. Now the backstory is she had developed over time hot flashes and night sweats, so she wasn't sleeping well. So she says, so I'm foggy during the day, I'm irritable, I don't want to be in the same room with my partner, I just don't feel like myself. Right. But also those hot flashes at night, she says, I don't even want to be in the same bed as this person because their body heat drives me nuts and it makes me sleep worse, so he's compounding my problem. So now they're separated from that reason. They also had not had intercourse for months because she had begun to develop some vaginal dryness and discomfort, so now it became a painful issue, and she stated that her libido was actually, she said, if I could give it a negative number, I'd give it a negative number. So she walked in and we did an evaluation and found that her estrogen, progesterone, testosterone were all very, very low. We talked to her about lifestyle, and we're getting into all of this, but lifestyle and health concerns and dietary concerns, but at the end of the day, from a medication standpoint, put her on some oral progesterone, an estradiol patch, a vaginal estrogen or estriol, and testosterone cream. 3 months in, she comes back, hot flashes and night sweats are minimal, she's sleeping. I'm actually able to have a conversation now without getting irritable, and I can listen to what he's saying. I'm not hot at nights, we're sleeping in the same bed. We've attempted to be sexually active, and it actually didn't hurt so much, and I didn't think it was such a bad idea. Mm-hmm. So we adjusted some things, because it's often common to have to adjust doses. With that tweaking, 3 months later, she said, I'm back. My marriage is back, my life is back, my brain is back, my body's back.
Yep.
And so she didn't realize how many things that hormonal imbalance was impacting in her life.
Right.
Until we got it corrected. But it wasn't just the hormones, it was a lot of other pieces as well. It's not, the hormones are a one-trick pony, you have to do the whole package.
Yeah, and we're going to get into all of that because there's so much interconnectedness.
I'll take it from a personal experience then, sitting down with my doctor. I'm a nurse, and I've had cervical cancer when I was 26, and ended up having uterus out after babies were born. And when that comes out, it changes you in your 40s. And so I decided I would try hormones for the first time. And back then, they tested you once a year for your hormones just to say, okay, can we give you some things? So the testosterone shot started first because I was 0. That led to hair growth on the face, pimples, all the things. And a year later, we're dealing with all these things. And then now fast forward to my 50s, and I meet with someone at Lifetime to do blood work every 3 months and manage it so much better. And now with ovaries out, it changed again. Mm-hmm. So there's always things you want to monitor, and I think the most important thing about hormones in particular is not just hormones, because when my hormones are balanced, I can maintain weight better, I can sleep better, I can do a lot of things better, and you feel like you're back to yourself, and that matters. But I think how it's managed is probably the most important thing when you're on hormones, to make sure that you're doing it right. And that's why I think this panel is so important, because it's not done right in many offices and or with many providers, and some providers don't believe in it at all. So you're kind of, as a consumer, kind of trying to figure out, where do I go for these quality things that I know can help me? Who do I meet with that can get me on the track to do it right?
And how do I adjust and iterate over time? Because we're not static beings, right? We're constantly changing. So, awesome, thank you. Well, you already mentioned, Dr. Pipper, the hormones. So I want to delve into those a little bit, because there are four in particular, well, there's several, but key female sex hormones, right, that we think of often when it comes to female, hormone balance. So let's start by talking about the estrogens and what those are in particular and what they do in our bodies.
Sure, we often talk about estrogen in generic terms. We say estrogen, but actually there's three that we focus on. So there's estradiol, that's the primary one that we think about. It's female sexual characteristics, the menstrual cycle, sexual development, and it can have impact in bone health and skin and hair and vitality, all those things. But that's the one that we treat most with, we focus on. Then there is estrone. Now the estrone is a bit weaker than estradiol. That's the one that primarily takes over in menopause. Then the body can take a little bit of that and make some estradiol when it needs it. Okay. But estrone isn't necessarily without problem, because when it rides higher, especially in menopause, that can be associated with weight gain, especially mid-abdominal weight gain. It may be inflammatory. And then there's estriol, which is the weakest estrogen. It generally doesn't stimulate breast or uterine tissue, but it's the main hormone that we have around in pregnancy. That's when it's at its highest levels. So those are the three that we mainly focus on and look at and talk about when we're thinking estrogen.
Yeah. Then there's progesterone,
Yep.
which you alluded to already.
Yeah, so progesterone is the hormone that's involved in the menstrual cycle. It kind of prepares the uterine lining for implantation, maintains that during pregnancy. But it's also the hormone that tends to drop the earliest in females. So our youngest patients that are having PMS, PMDD issues, progesterone is often the one that's kind of lagging behind, or it's dropping off. Progesterone can help with skin and hair and menstrual cycles and mood and
Sleep.
Sleep, absolutely sleep. Estrogen sleep as well.
Bone health.
Yeah.
Bone health. So it is probably the one we reach for earliest, and it is honestly a lot of women's favorite hormone.
Mm-hmm. So let's go from there. The one that is often, maybe women think like, oh, that's for men, testosterone. Yeah. It's something like, I don't want to build big, bulky muscles if I have too much testosterone in my body, but it's essential for women.
It is. It is equally a female hormone. It's just a different level.
Yeah.
So women need it as well. Bone health, muscle health, and maintaining muscle mass is important as we age, especially in females. And without testosterone, that's very hard to do. Libido, energy, sense of well-being, mental clarity, multitasking, things like that are the things we hear back from women that we've corrected their levels on, and they just feel all of those things have been impacted. Now, to your point, it does carry androgenic side effects like male side effects. We don't want to create hair. We don't want to, facial hair. We don't want to create scalp hair loss. We don't want acne. But those things can absolutely be managed, and as Connie alluded to, they do happen, but we can manage them. Mm-hmm. And one thing when I talk to female patients and we start bringing up the topic of testosterone, I'll hear, I don't want to be male, I don't want to be aggressive, I don't want to be, angry, and that is about as far from the truth as you can get. Generally, testosterone it's calming and it's confidence building, and people just feel better on it.
Mm-hmm. Great. DHEA. Mm-hmm. Tell us a little about, the next two are a little bit, they're more secondary, right?
Yeah, so DHEA is an adrenal hormone made in the adrenal glands. So it partners well with the stress hormones, adrenaline and cortisol. So because of that, DHEA is very important in people that have high stress levels. DHEA can help with energy, mood, libido, bone health. So it is something we reach for, it can be very helpful, but it's not quite as impactful on the same level unless you're under stress.
Got it. And then the last one we want to talk through is DHT.
So DHT we're going to talk about basically as a negative. So DHT is a direct metabolite of testosterone, and we think about it most as the side effects, the hair thinning, the acne, the facial hair. So we don't want those things. So when we're working with testosterone or just an individual that maybe has PCOS, our goal is to try to keep the DHT low.
Yeah. So a lot of these, when we often think of them, again, we think about reproductive health, we think about libido, of them being the effects, but they actually have much broader system-wide effects on the body. I've anecdotally listening to podcasts, I remember listening to one about estrogen, like estrogen and its role, and someone was talking about frozen shoulder and that being tied to estrogen. So I'd love to talk about if it's joint health that it's affecting, what are some of the other body systems that are being affected or influenced by our sex hormones?
You want to take it, Cliff?
Yeah, we had alluded to it, but Estrogen, progesterone play a critical role in bone density, connective tissue integrity, so think joints, ligaments. So when we're deficient in those, and especially if we're training pretty hard, especially here at Lifetime, we put those things at risk, right? So if we don't have the foundational hormones to rebuild and we're challenging ourselves through, high effort exercise, that's where we can have some complications in the joints, and then it can become that snowball effect. Now I'm injured, now I can't exercise, and now I'm frustrated, and then things can continue to snowball.
I think one of the big ones is that, when women are making estradiol, they have a very low cardiovascular disease risk.
Right.
But it turns out when a woman loses her estradiol production, which is happening, late stages perimenopause and then abruptly at menopause, more women die of heart disease post-menopause than men, and the reason for that is that there's a protective effect with estradiol. You make less pro-inflammatory compounds called pro-inflammatory glycans. When you have estradiol, you actually have protective anti-inflammatory glycans. And why glycans? You hear that word and you go, oh my gosh, what's a glycan, right? Glycans are a structural component of every cell in your body. So this has a dramatic impact on your cardiovascular health. And we've got to remember, we're all here for longevity. MIORA is longevity and performance health. The number one thing that will keep us from longevity is the fact that heart disease is our number one killer. So bioidentical hormones, the utilization of balancing hormones, key to that longevity quotient that we're looking for, right? Which is, how do I stay healthy as long as I can, keep my vitality, keep my blood vessels, neurovascular network working at its best possible potential. And I think we miss that because obviously we focus on sleep and hot flashes and libido and hopefully bone health. I'm passionate about that for women. But that cardiovascular risk protection is a big one.
Right.
On that note, we all talk about lipoprotein A as a really high-risk marker to have if it's positive for cardiovascular health and dementia. One of the few things that will lower lipoprotein A is estradiol.
So cognition, that's affecting cognition as well, right? Mood and all of those pieces, memory. Mm-hmm. Okay. How
If you're going to live that long, you really want to look good. Just saying.
100%.
It helps with the skin and all the other tissues. So if you want to be kind of, living long.
I love what you said about the skin, because I remember one of the nurses that worked for me who previously worked at a senior living center, and she could walk in when she did her initial evaluation on a woman, and she could tell immediately, based on her skin,
Yep.
oh, you were taking estrogen and you were not, meaning the folks that weren't taking estrogen, definitely more wrinkled, tougher, leathery,
Yes.
Skin,
Yep.
Not collagen rich. And then there was the women taking it, and then, oh my gosh, your skin's still glowing and you're 70 or whatever age they were at, right?
Yes. I've got a myriad of
Great.
ones that have and have not taken. And if you're going to live long, you may as well look great.
I love it. Keep those looks,
Right
right? I love it. Okay, so we've talked about the hormones already. There's a lot of information to take in for people. How do they start to understand where they are? Obviously, testing is an important element. So let's talk about what's the best way to go about getting a clear picture of your current hormone health status?
Sure, I think we've designed a very comprehensive lab evaluation that we utilize at MIORA. And that's meant to give a full picture of not just your sex hormones. Dr. Pippert mentioned, estradiol, estrone, progesterone, DHT, testosterone, but it's also looking at the influencing factors to those sex hormones like cortisol, like inflammatory markers, so that we see that whole person's chemistry sitting in front of us and not just saying, oh yeah, you're low in hormones, let's give you some.
Right.
It's how do we really evaluate you, and then not just evaluate you today, but on an ongoing basis, continuing to create appropriate recheck so that you can keep things in balance. Because to your point, when women are going through perimenopause to menopause, there are these shifts that are going on, and we need to stay on top of it.
You mentioned perimenopause, menopause. I think we need to define exactly what those are. I think more and more people are understanding the difference, but let's just say clearly, menopause is when?
It's a calendar diagnosis. It's
Right.
basically 1 year since your last period.
Yep.
Now that gets a little difficult to assess sometimes if somebody's had a hysterectomy, they don't have a period. So we don't know the dates, so that's when testing comes in. So we can kind of more accurately assess that. But it is a calendar diagnosis, that's what it is. And peri is the period of time leading up to that.
Which is often longer. I mean, I remember when I was reading more and more about this as I was approaching this age, it's like, it's not just a year or two technically. For most women, it's 7 to 10 years of your life leading up to that calendar date, as you referenced.
You know what I like, what you said, Jim, about the testing? What I like about MIORA's testing is that most patients come in and they think, here's my lab results, and I'm sitting in the range, right? This is the range from 7 to 22, but what I like about how the testing is given to our patients is that there's a middle of the range, and then there are the outer skirts of the range. And if you are in an outer skirt on the high or low end, it means you're headed for trouble at some point, but hopefully we can mitigate that trouble by trying to balance things out before you get there. And I think the testing is very robust in that, because patients are really sometimes not mismanaged, but not managed well when we're not looking at what's within the range, right? Because there's goods and bads and uglies in the range. So I like how we do that. I like the visualness of it, because it can be really challenging for patients to even understand all the numbers. Because I'll look at my pre-diabetic, it says 5.6 and it says 5.7 on there, but that I'm good, right? And you're like, yeah, but you might want to think about, so within the range of progesterone and within the range of, it can really be different for every human being.
Yeah, absolutely.
And I think that goes back to what was alluded to, the importance, because I think what we're talking about is the power and the impact of these hormones and how beneficial, but they don't come without risk, right? Just like any other medication. And without a trained professional and the visibility to how your body's reacting to it, because it's certainly not cookie cutter, right? And every individual is going to react to a different dose. And then secondary to that would be the reason you got there, right? And why we look at that full picture, looking at blood sugar irregularities, insulin resistance, gut health, detoxification pathways, all those things are the reason we have imbalance. And if we don't have the complete picture, we might be putting Band-Aids on a bullet hole, as Jim would say, because a lot of this is rooted in lifestyle, nutrition, lack of exercise or over-exercise that creates a downstream impact. And if you don't unwind that, you might feel a little better, but it's not going to be the full story. And without the supervision and the regular reassessments, because our journey changes, our life changes. We have kids, we have a stressful job, there's a family event that creates a lot of stress. Those things change, and without the regular oversight, that might need the medical change to dial you back in. So that's just one of my favorite parts around MIORA is you partner with your medical provider, the regular insights, that you have a partner in that journey. So when things aren't feeling quite right, you can reach out, get the support, and we have the visibility of what's going on with your chemistry.
Great. So let's say that somebody doesn't have access. MIORA, we have one main location right now, hoping to grow soon in the years ahead. What are some of the specific tests somebody should ask for if they're just getting, like, here's a basic hormone panel? Like, if I'm going to a doctor who's not MIORA, with MIORA, what should I ask for to get a clearer picture?
Well, I mean, if you're starting with the hormones, we want to look at estradiol. I like to look at estrone, progesterone, testosterone, dihydrotestosterone, DHEA, cortisol, the adrenal hormones. Super important and often overlooked. And that's from a hormonal standpoint, that's where we want to look at testosterone. Sorry, I forgot testosterone. We're talking about women.
Yeah, gotta need it. Still need it.
And with the testosterone, we want to look at the usable forms, the free and the bioavailable, because that's impacted by something called sex hormone binding globulin. And if that's out of balance, which it really can be in women, they look like they've got enough testosterone, but the usable's just not there for them.
And we measure that as well.
We measure
Sex
that
hormone
as well.
binding globulin's another piece of that puzzle
on our
that we
panel.
always are looking at.
I also think an important part when you're looking at sex hormones is to look at the others. Since you're running labs, many times if you're going to ask your provider is to run, your thyroid stimulating hormone, because the thyroid plays a big role, and also looking at your metabolic panel, because there's another big role that these all kind of play in the sandbox together, and they could be affecting each other. And there's some minerals I think are appropriate, and I also think that you just really have to look at your CBC as well, because it's kind of like a baseline, like how's everything going in there? Is there some anemias going on which can set things off balance in some different ways? But I do think kind of that general panel, along with all the sex hormones, is such a powerful way to start, at least with a baseline, because we could go down a lot of rabbit holes with labs, which are fun to do, but you can.
But then having someone who knows how to interpret them for you, which is what is the critical part.
Yeah, and I think one that's often overlooked is looking at your blood sugar regulation, insulin resistance. if you're not managing your blood sugar well, you're accumulating body fat. As you accumulate body fat, you're going to start producing more estrogens. When you're under chronic stress, your progesterone starts to go down. Now you have an imbalance in your ratio. It's critical to look at the liver, lymph, kidney to make sure that as your body's processing these hormones, you can actually eliminate them versus continue to reabsorb them, and again, get that imbalance. And then, especially when we start to get the menopausal phase, making sure that we have a full picture of your cardiovascular health and getting some of those advanced markers, because again, as Jim alluded to, that risk goes up significantly. But unfortunately, I don't know if enough practitioners are aware of that or taking a deeper look. It was just last week we had a woman come through the clinic, mid-60s, menopausal, and she was seeking weight loss. But as we were evaluating, she had significant cardiovascular risk as we looked in that metabolic profile, which was never on her other provider's radar just because she was a woman. So those are the things that are really critical to look at to make sure, again, you have that full picture, that full care plan, because it's not just about feeling better. Obviously, that's super important, looking better, obviously, but making sure you can do that for as long as you possibly can.
Absolutely.
And checking the labs, super important to figure out where you're at, but they're not the end all. You know, you're saying there's a wide spectrum of what can be normal. So labs can be used to gauge, you know, effectiveness, safety, but also to find a provider that looks at labs, is comfortable with them, and then is willing to say, well, gee, you're still having symptoms and your numbers look okay. What are we missing here?
Right.
Can't tell you the number of times we've cured hot flashes that were incurable with hormones by simply telling somebody, okay, let's cut down on the sugar intake. You know, let's get your blood sugar controlled. Without controlling that, hormones were not effective at that person's hot flashes.
Yeah. Well, and that really takes us into this next part of what we want to cover off. I was like, what can we do about this? Like, once we have the information, once we're working with a provider who understands the data, now what, right? And one of the things we really want to get into is bioidentical hormone replacement therapy, but we're also going to touch on all of the lifestyle factors. I want to start with the bioidentical hormone replacement therapy because, you know, it's something that we've been hearing more and more about. It was pretty controversial for a while, or people thought it was controversial. So let's talk a little bit about that and how that perspective has started to change a bit.
Yeah, I think, you know, bioidentical hormones, I know for myself, been working with docs using bioidentical hormones now for about 30 years. So they're not new, but there was this big misunderstanding because as soon as you hear hormones, oh, I shouldn't take hormones, it may increase my risk for cancer. That came out of some initial studies in the Women's Health Initiative, and those were synthetic progestins and estrogens that were actually derived from, you know, horse urine is actually what they were made from initially. And bioidentical hormones, just for the clear definition, these are hormones that are identical the way your body would recognize them. They're identical to what your body made. And so when you utilize a bioidentical hormone, you're giving your body something that your body completely understands how to receive the message. So, you know, it's one thing to have a hormone receptor. It's another thing for that receptor to function and how it functions. Inflammation is a big, big risk for not allowing those hormone receptors to do what they should do. And then also, if it's not a bioidentical hormone, it may not be giving the right signal or the length of time on the signal. And so bioidentical hormone replacement therapy's goal is to put physiologic hormones back into your body.
Yeah.
One qualifier there is we talk about bioidentical hormones as if they're something that is unusual and foreign, and they're not. They have been around for a long time, and there are lots of commercially available bioidentical products, estradiol patches, oral micronized progesterone. So we're using commercial products that are bioidentical. So you can certainly do this in a conventional setting. It's nothing out there, they're readily available to us.
So let's talk about it. Like you mentioned patches. What are some of the forms that you might get with the BHRT?
So I can talk about what I use. You know, the estrogens, for example, can come in a patch that you apply once or twice a week. There's topical creams that can be applied to the skin, vaginally, and those are the main forms of estrogen that I tend to use. There are oral forms. I tend not to use them because they are inflammatory, they increase clotting risk, and there are many studies that show that and back that up. Progesterone, oral, cream forms, DHEA oral, cream forms, testosterone injectable. I don't use the oral testosterone. It's available. Yes, I'm sorry. Yes, I do use oral testosterone. Rarely. Creams, there's no patches for testosterone for females. So those are the forms I use. I don't know what...
I use pellets. We have pellets in our practice, and those are great for like every 3 months if you don't want to be doing the creams every day. I think the one thing about creams to maintain is that your contact with other people when those creams are on your skin. Do you have small children? Are you lifting those children up on your legs if you just put the cream on your shorts or on your legs and you got shorts on? So, thinking about your lifestyle, and that's why it's so important to be with someone that knows and understands lifestyle inflammation, because as you're taking these things, like what's best for your lifestyle? Is it a shot of testosterone every week? Or is it a pellet that lasts for 3 months? Is it, there's lots of things that go along, risks and benefits of all the different types. It's wonderful because there are so many different types, because we can fit lifestyles better and we can customize a lifestyle with so many options, which is great.
And just a note on the creams, right? The 3-hour window is kind of this sacred space where if you're a female applying an estrogen cream, you would want to avoid contact either with your partner or with your children. So no direct skin contact 3 hours after application.
That's a long time if you've got young kids or whatever, wherever you are in your life. Yeah.
Absolutely.
How would someone know if a form isn't right for them? Have you seen examples of like, oh, the cream is not for me, or, what does that look like?
Sure.
Jump right over. Take it. You got this.
Let's talk progesterone for a second. Progesterone comes in an oral form. It comes in a topical cream form. You put it in the mouth, therefore the GI tract. Some individuals might have heartburn or reflux or bloating. In that person, the cream might be better tolerated because you're bypassing the GI tract. The cream might be converted a little bit more to cortisol. That can happen. And so that person, if they're high stress, they're anxious, maybe that's not the best form. Sleep is a little bit better with the oral form in general. So you can use those forms and pick the individual, and you start with one and the thing that's most likely to help, and if it doesn't, you have a backup. You can try something different. And dosing makes a difference as well.
I think the one thing is they don't feel good.
Yeah.
Yeah, right.
Hey, you know what?
Obviously.
I had hot flashes and I was, having trouble sleeping. Now I have hot flashes, trouble sleeping. Now I'm really irritable. And, so that's the big one is, do I feel better? Yeah. I think the one thing we focus on at MIORA is all of the providers, we're focused on moving a person forward towards, am I feeling better? Right? Mm-hmm. So I think that's the key piece to it is, did you feel something positive or did something negative happen? Hence the importance of regular rechecks or visits and communication. It's also why it's important, we like to get the trainer involved as well, because many times people are seeing that trainer 3 times a week, whereas they may only be discussing something with our provider every few months, unless something comes up and I need to get a hold of them, right? So that's what's, I think, really beautiful is that we've created a team concept so that that person that is doing advanced therapies, we kind of got our arm around them. Mm-hmm. Whether it's from the trainer, the dietitian, our fantastic providers, but there's a team around them to make sure that we're moving their health forward.
Right, and it's based on them personally and all of their chemistry in those pieces.
And I think one thing that we also do that I don't think we've directly addressed is comprehensive symptomology questionnaire regularly, because again, if you feel unwell and you feel a little bit better, that might in your eyes be good enough, but again, with regular assessments and painting a picture of what you could feel, really dialing them and painting a picture of what could be as we continue to fine tune and integrate new protocols and strategies and modifications. So we make sure that our providers do the comprehensive questionnaire, but are really dialed into the individual. Mm-hmm. And we've heard it time and time again of how great it was for the provider to really listen and what my goal was and be a partner with what I'm trying to accomplish so that we can create the right care plan.
Yep. And things change, priorities change.
Yes.
You walk in the door, I can't sleep, I've got terrible hot flashes, that's my priority. Those are gone, I'm sleeping better, I feel better. Now my skin doesn't. Now I don't like that. That's my priority now. So being aware of that, being sensitive to asking and staying in touch with people, well, what is the concern today? What can we adjust today? Not just, okay, we hit that one out of the park, we can't do anything else.
I like what you said, because I think sometimes all the things that we test can be really overwhelming for a
Yeah.
patient. And you start looking, you're like, your cortisol is through the roof, your AHCRP is off, you've got, low T, no progesterone. You start going through the laundry list, and they look at you kind of like with eyeballs of like, what do I do now? And if you can meet them where they're at, I think it's so important in all the things that we do as providers, because if you can meet them where they're at and help them with that, then that develops trust, and now I can hand them off to a trainer, a nutrition, and we can work as a team. So getting that first initial assessment, symptomology, labs, and trying to dial it into what's their number one priority or number two or number three, and making it happen for them, or at least getting them to the next notch, then it's kind of like, okay, I want to keep going. How can I keep my health looking even better?
It's kind of like habit stacking in some ways. It's like you start with one thing, kind of get comfortable with that.
Atomic Habits.
Yes.
It's a great book to
yes.
read.
And change happens, then you add something else,
Yep.
and you build from there, right?
Yes.
Over and over. It's similar with this. So I want to go back to bioidenticals for just a second. Like, so if somebody goes on them, how long do they have to stay on them for? Can I take them for just for a limited time? Does it depend? I mean, it's going to adjust potentially depending on how my life has changed.
Personally, I'll stay on them until I'm dead. I'd rather die young than not take them. So that's just me.
Yeah.
I have been on hormones of various shapes, sizes, and types since I was 45.
Okay.
And have evolved into my closer to 60-year-old space, and happy to be here. And I hope that I can take them forever, because I do think they make a big difference. There are patients that have to go on them for certain reasons, then off them for certain reasons,
Okay.
depending on health, wellness, surgeries, various things. So I think that obviously working with a provider closely is really important to meet their needs, but I can't see a reason to go off. And cancer doesn't scare me. I've already had it.
Right.
And I hear similar sentiment from a lot of people. They say, I'll stop when I close the casket.
Yep.
But to that point, do we have to stop?
Right.
Well, if there's a reason that develops and we have to, well, we'll find other alternatives to take care of those symptoms, and that's where working with a provider that isn't have one thing in their focus. Well, we have other tools in our tool belt. But I would say taking it as long as the individual feels that it's offering them benefit. I don't want to be giving somebody something if they don't see benefit in it, if they don't think it's helping. Sometimes we may dial back and stop it, and then we realize, oh, it really was offering benefit. But that benefit can be things we feel, but it can even be bone health. That's silent, but that is a huge risk factor as we're aging, and that is one of the things hormones do best, is maintaining bone health.
Right, because like the risk of falling and breaking something as the years pass increases exponentially, right? Like it gets up there.
Yeah, and it's significant, right? I mean, people should know, 20% of people that have a bone fracture, especially a hip fracture, they die from that, and 50% will lose a degree of their function or their ability to move. So if I was walking, maybe I need a cane. If I had a cane, maybe I need a walker. If I had a walker, maybe I'm in a wheelchair now. All of that is absolutely counterculture to what we believe in, which is we want to keep people moving all throughout their life, being able to be vital, reduce those risks, right? Because when Connie was talking about lab values being in range, but kind of on the fringes of being in range, that's all about identifying where are you going? What direction is your chemistry heading into? And let's move you from one of frailty, fracture, being overweight, dealing with potentially heart disease or diabetes or other issues, and let's move that needle down that path of great resiliency, great metabolic reserve, feeling good when you wake up in the morning, understanding that you can get a good night's rest, and really moving that thought forward as a consistent way of living, right? And hormones play a role in that, just like exercise does, just like diet does, just like mindfulness does. So important for people to understand how to manage their stress. All of that kind of comes together.
Yeah. Well, you're really talking about that health span within the lifespan, right? And it's not just that, it's also like your vitality span. Like you want to be energetic and, living your best life for as long as possible within that. And if you don't feel good, you're not going to be living, your best life in there.
And you'll see that your lab values will change for the better when you start managing a better lifestyle.
Yeah.
So if someone doesn't want to start on hormones, they can always start on lifestyle. Like there's always
Yes.
something to work on. So maybe they're really, I don't want to do hormones yet because it's too expensive for me, or I think investment into your healthy self is way better than trying to invest in your sick self later.
Right.
So it's like trying to figure out how you can manage maybe your lifestyle first then, and then we can work on other things later if we need to.
Yeah. Well, actually, that takes us right into our next topic, which are those lifestyle factors, which we talk about all the time at Lifetime: the exercise and movement, nutrition and supplementation, stress management, sleep. Let's dive into each of those, because we know that they're part of that web where it's like if you exercise, you may eat better, it may influence your hormone. That's all this interconnected web of things that are working together. So let's dive into exercise and movement and the role that that plays. I'm going to throw it to you, Cliff.
Wonder why.
Right, like look at him. Yeah.
It's an interesting topic because it has fringes as well, right? We have the underactive people. So if you're not overly active, you're not going to be, and just activity alone is a stress reliever, helps manage hormone levels, but helps make sure that you're insulin sensitive and you can manage blood sugar, right? And if we're inactive and our diet isn't necessarily in the right hemisphere, we start to get some insulin resistance. We start to accumulate body weight. We start to develop cravings. And as we alluded to earlier, when you have insulin resistance, estrogen can start to go up. You start to have ups and downs in your blood sugar, and then your blood sugar goes down. You have to lean heavily on those adrenal hormones, and that creates an additional external or internal stressor on your body, and then you start to unwind those things. And then we go into the over-exerciser, right? I'm a total victim of this myself.
No.
Really?
But
You exercise?
on occasion. But there's people that just love to exercise, and more is better, right? When we coach our folks, we try to say more is not better, better is better. Because then you go in the other hemisphere where you're starting to push the body too hard, and if you don't have those resiliency hormones to recover, repair, you don't have the nutrition to recover, you're not getting good sleep, then you start to get really inflamed. You start to produce more cortisol. That drives a new set of cravings. You can't sleep, and our body isn't changing, so we often reach for more. I need to do another class. I need to get another lifting session in. I might need to cut calories a little bit more. And again, we create this vicious inflammatory storm, cortisol storm within ourselves.
Right. What are some of the factors that women in particular need to think about with exercise? I know I've seen a lot where it's like I'm 90% of my routine is cardio, and I have a little bit of strength training in there, but strength training really matters, especially from that bone health standpoint.
For sure. So putting stress on the bone helps rebuild and repair bone. It's going to help make sure that your connective tissue, those ligaments, those joints stay strong. It'll ensure that you maintain adequate muscle mass, and as Jim would always says, muscle mass is the currency of aging. So if we don't have a good foundation, that your quality of life as you age will go down significantly and impact your ability to move and especially do the things that you really love.
Right. Okay. Anything else? Anyone movement, exercise to add? Because we're going to move right on to nutrition and supplementation,
This
which
could
I
be
know is
its
a
own
hot
topic.
topic. 'Cause we could just talk about this. But let's talk about nutrition for a bit, because there are foods that can really support female hormone health and also some that might detract, right?
Yeah. So we, again, alluded to it earlier, but standard American diet's pro-inflammatory. It's high in refined sugars, which goes down that path of insulin resistance. As Jim talked about, pro-inflammatory foods will make that receptor not as responsive. Our stress levels have already made our hormones complicated. We might not have enough, and now that receptor isn't receiving the signal to repair, recover, manage stress, manage mood, manage skin health, all those things for sure. So some of the things we really focus on is making sure that people are eating a well-balanced diet, and again, that is a spectrum of individuals, but really helping them identify, if we just talk about specifically carbohydrates that work within their activity level, their muscle mass, so that they don't have those big influxes.
Right.
Part of that would be getting adequate fiber every single day. In my experience, it's when I ask somebody how much fiber they're getting versus when we do a diet intake, it's quite varied.
There's a gap.
Yeah. So usually for a female, I'm 25, 35 grams of fiber spread out throughout the day. Often we're not reaching for those fibrous vegetables, so we'll encourage somebody to take a fiber supplement that helps regulate blood sugar, but it also helps feed good gut bacteria, is where we're going to actually start to detoxify some of those metabolites of, example, estrogen. So if I can't eliminate those things, I continue to recycle them. And then chronic stress drives my progesterone down. I'm not getting rid of my estrogen. I get this big variance, and then I get some of these complications.
Yeah. You're alluding to the microbiome health too, and that really matters here.
It's really significant in terms of how you metabolize hormones. And so, a high sugar, high refined carb diet, problem, well, discussed. And then also a high fat diet. So it's very popular right now for people doing, carnivore, ketogenic diets, which are void of fiber. And the big thing with fiber, as Cliff said, fiber helps you to help your microbiome maintain its diversity and its health. The problem that happens is when you start to eat high sugar, high carb, or high fat, not a lot of vegetables, not quality protein, but just high fat or the other spectrum, is that you actually make an enzyme in your body. So your body takes estrogen and it has to get it out of your body.
Right.
So your liver puts a handle on it to carry it out. That handle's called glucuronide because it goes through the liver, glucuronidation, and you get a handle. Well, when you don't have good bacteria, unfriendly flora grow, and they make an enzyme that basically the enzyme goes and it chews off that handle. The handle falls off. And when the handle falls off, you have more circulating free estrogen. So we hear this term all the time, estrogen dominance.
Right.
So more estrogen gets stored in your fat tissues and gets stored in your tissues, and that can be dramatic. And I'll tell you what, I do a lot of talks to physicians on hormones, and it is rare for them to say, oh yeah, I make sure everybody's getting 35 grams of fiber a day in their diet, and I count it, and I recommend a fiber supplement to make sure they hit that target. And that could be one of the most important things you do to manage your hormone health. So if people are listening,
Right.
the very first thing they can do is start thinking about fiber as a vital part to managing their microbiome, but also managing your hormones.
Yeah. When you don't often connect those two.
Yeah, and one add when we bucket these together, often when we go back to that over-exerciser, specifically when they start doing over-cardio, they start to produce something called a lipopolysaccharide, which is an inflammatory compound created in your gut. So again, it all plays, it's a matrix, as we would say, of these different components, these lifestyle factors that ladder up to bigger hormonal problems. So again, that's going back to the importance of having that full picture, that full thought, that care team that understands exercise, nutrition, and the medical care that's synergistic together so that that person's well taken care of.
Got it.
I would say under all of these things that we're talking about, in my world, I feel like sleep is the most important bedrock of everything, because if you're exhausted, you're not getting any sleep, you have no deep sleep to clear the toxins from your brain, you have no REM sleep to restore, all those things, you could care less if you're eating nutritious food or getting out to the gym. So I now with my patients ask, I want to know how you're sleeping, and I want you to get a tracker because I'd like to see where you're at. And there's some great studies out there on sleep and how important it is with hormones, with your ability to work out, with your ability to take care of yourself even, that I think underneath all the pillars that to me is like one of the more important ones now that I've been doing so much research in my world. But all these things matter a lot. But if you're exhausted, you could care less.
So what are your top tips for good sleep?
You know, I
Make
think
sure we
there's a lot in there about sleep hygiene, about things you can do to help yourself sleep. There's also cognitive behavioral stuff that you can do if you really truly have trouble sleeping. I think one of the most interesting books I ever read was a book called Why We Sleep by Dr. Matthew Walker. And a lot of the studies that he pulls out that I go back to research, it's really incredible as to even our young people, the whole ADHD and ADD phenomena that's going on is really a possibility of sleep disorders. And people just aren't getting good sleep. We've got blue lights going till we shut our lights, our eyes. We go to sleep to the television, to our computers. You know, the blue light thing I think is something that we really have to consider. I think how we eat up until a couple hours before we go to bed, what our kind of eat time is, how late we work out. I know when I'm on my power plate really close to bedtime, my sleep sucks. I see it the first, there's not enough deep sleep, and there's things that we can do to help our sleep, and then once we manage that, then we should plug in all the other things to kind of help ourselves.
Right.
And the one point on sleep's when you have trouble with sleep, so you have insomnia or fractured sleep patterns, it's a disorder of hyperarousal of your brain. It's called hyperarousal disorder of the HPA axis, hypothalamus pituitary adrenal axis. And so what I always try to get people to understand is you probably need to work on your daytime stress to help your nighttime hygiene.
Yeah.
So it may be, I'm going to do some deep breathing a little bit. I'm going to unload that sympathetic stress, that white tiger phenomena that's coursing through me during the course of my emails, my text messages, I'm late for a meeting, whatever that is, right? You really want to understand sleep. A good night's sleep really starts with a proper approach to your day.
Yeah.
And that may mean taking a nutrient like suntheanine or Relora, things that help to reestablish your normal stress rhythm to help you get into that space. So it's I couldn't agree with you more, Connie. I mean, sleep is foundational to everything. You know, it's how we're going to age gracefully as we can get a good night's sleep.
Yeah.
And when I'm working with individuals, Connie had alluded to that importance of that meal in the evening time, really throughout the day, right? We want to keep a balanced blood sugar that keeps cravings off, but everybody has limited willpower in a given day. And through our stress, through our not running a car off the road, tolerating our boss, things along those lines, we run out of willpower. And that's where most people really struggle, is in that evening time, right? At the evening, I'm just like white knuckling, not diving into the chocolate. And so you're not a bad person. It's just you have run out of that capacity, especially sleep reinvigorates that. But that evening meal often is more sugar-based. It's more refined, processed foods, which will start to elevate your blood sugar going into your sleep time. Your body doesn't like high blood sugar, so it secretes a hormone called insulin. Your blood sugar starts to drop. And then often when I'm working with individuals, they'll say, yeah, I have broken sleep. And I go, do you wake up between 1 and 3 in the morning? They're like, how did you know? Well, it's pretty typical. Based on what you ate, in about 3 to 4 hours, you're going to get into that lull, and you can't eat at that time. Before, I'd reach for a donut, I'd reach for a granola bar, I'd reach for a cookie, something to get me back to feeling normal.
Right.
Well, my body can't do that while I'm sleeping. Now, granted, some people might sleepwalk, but so your body has to secrete an adrenal hormone, cortisol, epinephrine, norepinephrine, to bring your blood sugars back up, and you wake up startled. You go to the bathroom, you come back, and then that becomes a cyclical pattern throughout your day. So protecting sleep is, to Jim and Connie's point, isn't just a take a melatonin, turn off the blue light. It is a full thought process to prepare for sleep and protect your sleep.
Yeah, and as you alluded to, it starts at the start of your day often. Like this goes back to, again, we could do a whole another session on circadian rhythms and like how light exposure in the mornings is important and all of those pieces. We'll come back to that hopefully at some point.
Let's go.
Yes, I love that.
Anything to add there for lifestyle? I know we alluded to stress management, mindfulness in this. I want to make sure we don't miss that piece of it because so many of us are dealing with chronic stress in our lives.
Yeah, I mean, I think everything that was alluded to, timing of meals, understanding your stress. I mean, sleep hygiene is incredible. I mean, I remember I've got business executives I talk to that have 2 phones at night at their bedstand, and it rings or it lights up, and they don't even realize the impact of that. So I think that's, the big issues that we addressed it pretty well.
Yeah. How about advanced supplementation if needed to supplement nutrition and diet?
Yeah, we have a host of ones that we'll use, and I'll let the providers obviously jump in, but making sure they have the foundation set. When we go back to some of the complications we see, obviously stemming from things like insulin resistance, magnesium is a critical one that we see. It can help with hormone regulation, helps with glucose metabolism, very relaxing to help protect sleep. We talked about the fiber component. I challenge anybody listening, as you're going through your diet, just look at the package, look at the food, and tally that up. You'd be surprised that when we're thinking we're getting 20 to 35, we might have hit 11 or
Right.
12, right? So incorporating that fiber, you'll find a new level of satiation, which prevents you having to challenge yourself for those cravings. And then again, it starts to snowball in the right direction versus the wrong direction. Then we have some advanced supplements. Diethylmethane can help eliminate if we're going through someone that has more estrogen dominance and maybe they aren't ready for a progesterone, or maybe we're just trying to bring that down. Progesterone's in a pretty good spot. Those are some other ones that we have available or that we offer individuals for sure.
Awesome.
And diethylmethane sounds like a chemical. It's 8 pounds of broccoli in a pill. So it's derived from broccoli. So it's a broccoli extract. Sounded kind of scary, right? Diethylmethane, but
Like
it's
that.
what our preference is. we're going to look for natural compounds wherever possible to help people guide their way through that healthy way of life. Look, some simple ones. Omega-3 fatty acids are invaluable. Zinc is essential for ovarian health. It helps you to create hormones. And zinc deficiencies, we see them at that lower end, to your point, that low end of the normal range instead of being at the optimal side of their normal range. And zinc can have a pretty dramatic impact because it runs an enzyme called aromatase. And aromatase takes your hormones and pushes them in the wrong direction. And we want aromatase inhibition. When your zinc is low, you can't do that. And obviously, just a good foundational multivitamin, and the reason I say that, we need so many different nutrients to help our liver go through the processes of detoxification. And when we take hormones or any other nutrient or anything we get exposed to, our liver has to be involved. And so whether it's B vitamins, amino acids, vitamin D, selenium, real important, all of these nutrients are playing a foundational role in helping us to take in what we bring in as nutrients or what we get exposed to, and then be able to process them. And so super important.
Yeah, and many of these we actually carry at Lifetime through our LTH line, which
Got a
is great.
phenomenal AM/PM multivitamin, very comprehensive. And actually the quality of the nutrient that is selected makes a big difference too. And we have a full thought on the quality of each of the nutrients that go into, not just the Lifetime Multi, but as you can see here, there's a variety of LTH products. It's always about the quality of the ingredient and then how much is needed in order to create a beneficial change.
Exactly. Well, I know our time is dwindling, so I want to make sure to get to a couple more things and just know, there's a lot we've covered here today. So how does somebody start to, bring this all together in a plan that's actually sustainable?
Go see Connie.
Yeah, come over. I'll help. I think, Cliff, you mentioned it, and Dr. Pippert, you are seeing patients every day like I am. When you sit down with that patient and meeting that patient where they're at, really finding out their symptoms. Obviously, you don't have labs. Sometimes the first time you meet with them, you have all their symptoms, and they're going to lay them out for you. And I think it's up to us to ask them a lot of questions, because sometimes they think their symptom is this, and really it's not, it's this. So you're really trying to play detective a little bit on their lifestyle. Many times they won't even really admit to their lifestyle because maybe they don't trust you enough yet to say, I do have chocolate and 3 glasses of wine at 9 o'clock every night because that's who I am. It takes a while sometimes to get under all the covers and really just kind of let them uncloak a little bit. Once that symptomology is in, it's really figuring out what are their priorities. Now I have their labs, now we can put them together and let's start a program. Sometimes it's financial based. Sometimes it's I don't have $3,000 to do this and I have $800 today. And I'm always anything you can invest into yourself is worth it because you're the only one that wears you. And you're the only one here, and there's no investment to do if you're not here tomorrow. So, I talk about if I gave you $1 million, would you take it? And they'll say, yeah. I'm like, but what if you couldn't open your eyes in the morning? Would you still take it? No. So the health of them is so important, and we're trying to help them prevent aging versus maybe traditional medicine where they come to us sick. So we also have to help them understand that usually they're in our chair because they want to do something. It may be a fiber supplement, it may be a nutrition evaluation, but I feel like you meet them where they're at and then you try. If you put too much out there, I listened to Cliff with his exercise stuff and I'm like, oh my God, I'm a failure. Because I don't look like that, and there's no way I can get there. But
thank God.
But one thing at a time is I need to work on my sleep, obviously, because I'm not getting enough, and it says so. So if I can work on a couple of things, and that's where those return visits, let's give you this homework to do today. It's not a lot, but it's in the right direction. As you do these things, I lost a significant amount of weight in about 1.5 years. And it took me a while to get all my lifestyle things together, stress being one, so many things. Then sleep I could work on. Then the exercise I could work on. But I think you've got to, you have to walk before you run in this area. And then as soon as you're running, you're like, oh my God, I'm actually running up those stairs. I can do it. The knees don't hurt. I'm not out of breath. Then the excitement comes in now I want to go look like that guy because I think I can. Those are the thoughts in your patients because they start to get excited that they've made changes with your help and they start to trust you more and more and then you get to guide them a little bit more.
On the cost, I know, Greg, you've done labs forever. and I know you've commented on this in the past, is just how fair the pricing is on labs.
Yeah, one of the things that MIORA has done is negotiated prices with the labs that are incredibly favorable. Now, we are cash-based for those labs, but because of that, we're able to get the discounts. Now, in past lives when I've run these large panels of labs, and say a person says, I want to submit them to my insurance because I have insurance, I want to use it. Often those times those patients get a balanced bill for those, and the panel that we run, I've seen literally people get balanced bills for $3,000, $4,000 just for the labs. Wow. And when we see people at MIORA, I mean, that is way less than we charge for the dietitian and the provider time and the testing, and so it is a phenomenal value the way we put it together.
Yeah. Well, we are almost out of time. We actually are out of time, but I want to give you each a quick chance to say like one final thought as we kind of go down the line here, and then we'll wrap things up.
Don't be scared of hormonal transitions. Instead, lean into them, understand your body. Like you said, nobody's going to care about your body more than you are. And don't be afraid of asking questions about that transition time, and seek out help.
Got a couple great books that I think a lot of patients appreciate reading. Good Energy being one by Casey Means, and then Outlived by Peter Attia. Yeah. It might spark some curiosity, which then can get you into the chairs of providers to say, hey, I read this, I'm looking for that, and it really comes to and get you excited about your self-care.
Thank you.
And then just finding a provider that you can partner with, because it is a two-way street. You have to be able to speak to them honestly about your concerns. They have to listen, and they have to give you and meet you where you're at. This is what I'm willing to do. Without that partnership, it's not going to work as well.
Yeah, to just echo that, if you're not proximate to MIORA, do your research, because it's becoming easier and easier to get access to hormones and peptides without a lot of medical oversight. So do your research, make sure that you find a provider that you're confident is looking at your total body chemistry, that is willing to partner with you with regular assessments, and they don't overlook or don't take accountability in the journey when it comes to exercise, nutrition, and lifestyle, because if they don't have that full care, you might not get the answer you're looking for.
Well, thank you all so much for joining me today. I know we're going to be back next week. Next Wednesday, November 13th, we'll be talking about male hormone health and their balance and optimization. And to everyone who joined us today, thanks so much for joining us. If you want to learn more about MIORA, you can visit miora.lifetime.life, and we'll go from there. So we'll see you next week. Thanks, everyone.